Welcome to our exploration of how science and religion can work together to enhance healthcare. For many, faith and medicine represent two fundamental aspects of the human experience. But what happens when these two seemingly disparate worlds intersect? Today, we'll uncover 8 key ways these two powerful forces can collaborate for the betterment of patient care. We'll delve into real-world examples and the latest research that illuminates the profound synergy between science and religion in healthcare. This isn't just an intellectual exercise. It's about improving the lives of patients, their families, and entire communities. So, let's begin this journey of discovery together. When we think about healthcare, we often focus on the physical body, treating diseases, mending injuries. But what about the human spirit, the emotional well-being that's so essential to the healing process? This is where the integration of faith and medicine shines. Think about a patient who has just received a difficult diagnosis. The fear, the uncertainty can be overwhelming. In these moments, the presence of a chaplain, a hospital imam, or a rabbi can provide a sense of comfort and hope that transcends the purely clinical. Many hospitals now incorporate chaplaincy services, prayer groups, and faith-based counseling as part of their standard care. Medicine is constantly evolving, pushing the boundaries of what's possible. But with these advancements come complex ethical dilemmas. Religion and spirituality offer moral and ethical frameworks that can help guide these complex decisions. By engaging in thoughtful dialogue between medical professionals, ethicists, and religious leaders, we can navigate these ethical crossroads with greater clarity. Long before the concept of organized healthcare, religious communities were often at the forefront of providing for the sick and the poor. This commitment to social justice and community well-being continues to this day. Across the globe, religious organizations play a vital role in public health education, promoting healthy lifestyles and advocating for access to quality care for all. This dedication to serving the most vulnerable is a testament to the power of faith in action. We've made incredible strides in understanding and treating mental health conditions, but the stigma surrounding mental illness persists. This is where the dual approach of medical intervention and spiritual support can be particularly powerful. Faith communities can play a vital role in reducing stigma by creating safe spaces for people to talk openly about their struggles with mental health. At the same time, it's crucial to acknowledge the importance of evidence-based mental health treatment. It's about finding the right balance between faith and science, recognizing the unique needs of each individual. The desire to heal transcends borders and belief systems. Throughout history, religious groups have been at the forefront of providing medical care to those in need around the world. Think about the work of organizations like St. Jude Children's Research Hospital, founded on the belief that no child should die in the dawn of life. Or consider the countless medical missions organized by churches, synagogues, temples, and mosques, bringing essential healthcare services to remote villages and disaster-stricken regions. These efforts are not just about providing medical care. They're about restoring dignity and demonstrating the transformative power of human connection. Working in healthcare is both a privilege and a profound responsibility. Doctors, nurses, EMTs, they face immense pressure, long hours, and the emotional toll of witnessing human suffering on a daily basis. For many healthcare professionals, faith provides a source of resilience, a way to find meaning and purpose in the midst of challenging circumstances. Religiously affiliated hospitals often provide chaplaincy services specifically for staff, recognizing the unique spiritual needs of those who dedicate their lives to caring for others. Death is an inevitable part of life, yet it remains one of the most difficult topics to discuss. How do we approach end-of-life care with compassion and sensitivity, honoring the wishes and beliefs of the patient and their loved ones? Religion and spirituality can provide a framework for understanding death, offering rituals and traditions that bring comfort and meaning to the dying process. Palliative care and hospice services often integrate spiritual support as part of their holistic approach. Medical research holds incredible promise for alleviating suffering and improving human health. But as we venture into new frontiers, like genetic engineering and artificial intelligence in medicine, we must proceed with caution and ethical clarity. Engaging in thoughtful dialogue about the ethical implications of emerging technologies is essential to ensure that medical advancements respect human dignity and moral values. As we've seen, science and religion don't have to be in conflict. Instead, they can complement each other in healthcare by providing a more complete approach to healing. When we embrace the interconnectedness of body, mind, and spirit, we unlock a deeper understanding of what it means to truly care for ourselves and one another. By seeking understanding, consulting trusted experts, and looking for common ground, we can make healthcare decisions that honor both our religious convictions and our physical well-being. Thank you for joining us in exploring this harmonious approach to healthcare.